down, sports bra, shorts, etc. Shoes and socks off, just like she is now. Preferably, probably not a head, you know, I can take it off now. You don't have to take it off. Not a headband typically, because you need to check for ingesting. Hopefully you don't have it. Any questions? Okay. When I did it on Tuesday, I missed Romberg, and I always miss Romberg for some reason. And I missed clubbing, so hopefully I won't miss those for you guys. But the rest of it is pretty okay. So I'm going to start off with walking in the room. Hi, I'm Jamie. I'm going to be your nurse today doing an exam. How are you?
Good. I pulled him down at like 2 or something. Disgusting.
I think you look great. Okay, so I'm going to start, I'm just going to do a physical exam. So I'm going to start off looking at your skin. I'm going to be feeling your warmth and texture. Checking capillary refill, which you can do now, or you can do it later with respiratory or peripheral vascular. So you have a couple options. I'll check for skin turgor. And I check in a couple places. Okay. And if you have any questions about that, there's anything, pretty much looking at the nails for color and color vascular lesions. So now I'm going to do a head inspection.
2 minutes off. Okay.
I'll inspect your hair, looking for lumps, lesions, infestations. Do you have any tenderness? I'm checking out the texture of her hair, noting that. I'm going to look at her head and the overall proportion of the head to the body. Looking at symmetry of her features. Looking at the ears to make sure that they're in good alignment with the eyes. Looking at the brows and the lashes for scaling and infestations. Noting the color of her sclera. Noting the color of her conjunctiva. Looking at the color of her iris. Noting the shape of her pupils, they should be symmetric. Palpating the ducts. Looking for drainage. Okay? Go ahead and I'm going to shine a light in your eye. You just look straight at my fingers. So I'll take one swipe and I'm looking at direct pupillary constriction of this eye. I'll swipe this eye again, but I'm looking for consensual pupillary constriction in the other eye. I do the same on the other side. Go ahead and test your extraocular muscle. So I'm going to have you.
You're fine.
I'm going to have you follow my fingers with only your eyes. Okay. When you do this, you want to make sure you're tracking slow enough. Patient's following you, holding out for nystagmus. And she has a beat of nystagmus, which can be a normal finding. Rest your eyes for 1 second.
Thanks.
And now we're going to check for accommodation. So I'm going to have you look at a spot across the room, and then look at my fingers. Right? So she's looking across the room, her pupil should be dilated, and when she looks at my fingers, her pupil should constrict. You can do it the opposite. You could have her look at your fingers and then look away. You have the opposite reaction, and it would be fine. Okay, so I'm going to go ahead and palpate your ears. Do you have any tenderness? I'm looking for lumps and bumps. I'm palpating the tragus, making sure that's fine. And I did note the alignment, but I did it over in head and not in ear, but that's okay. Either way is fine. I'm going to inspect your sinuses, or palpate your sinuses. Do you have any pressure or pain when I touch your sinuses? Okay, I'm going to test your skeletal integrity of your nose. That's good. Can you close one of your nares and take an inhalation in, and the other side? That's very nice. And I'm going to now go ahead and look at your mouth. So at first I'm looking at her lips, noting the color and the moisture level of her lips. And can you smile? Looking at the general condition of the teeth. When you're working in the mouth, make sure you're wearing your gloves. And you need a light source. You should have a tongue depressor and 4x4s. So first, I'm just going to be looking in your mouth, on your, get your pupil mucosa, looking at all your teeth, looking at your hard palate and your soft palate. Can you stick out your tongue? And can you move it side to side? Good. Moistening out. Go ahead and stick your tongue out and say ah. And when she says ah, I'm looking for the uvula to rise and stay midline. It may quiver and that's okay. Looking for the soft palate to rise. And now I need to have you stick out your tongue. I'm just going to make your tongue dry. Stick out your tongue. And I'm looking underneath of the tongue for lesions or sores. I don't see anything there. And I'm going to have you, I'm going to test the strength of your tongue. If you can press your tongue in your cheek against my fingers, that's good. Tongue in cheek against fingers, and we'll use the 5 out of 5 muscle scale for that. And we'll say strength 5 out of 5 bilateral and 2 resistance. And now I'm going to have you make 3 faces so we can test your trigeminal nerve. Can you smile? Good. You're looking at the nasolabial folds. And can you raise your eyebrows?
None of this.
Okay, can you close your eyes? And don't want me to open them. You have muscle strength, and that was great. So now we're going to do a soft touch and a sharp versus dull. So you can do this 2 ways. You can do it like this. Close your eyes and tell me when you feel this. Or you could say, does this feel like this?
Yes.
Does this feel like this? Does this feel like this? And now we're going to do sharp versus dull. You need to break your cotton swab in half. And you need to tell your patient this is dull and this is sharp. Okay, you'll be able to distinguish those. And again, you could say, does this feel like this? Or you can just say, close your eyes and tell me if you feel sharp or dull. Close your eyes for me. Tell me what you feel.
Sharp. Dull. Sharp. Sharp. Dull. Dull.
And notice when I'm doing either of those, I'm not swiping, I'm touching lightly. So swiping is wrong. Okay, so we're going to go ahead and take a look at your neck, and I'm noting the symmetry of the trachea. And I'm going to have you just swallow, and I'm looking for the the thyroid cartilage to rise and fall, and that's rose and fell smoothly. You can do a dry swallow, or you can do it with water, whatever you prefer. So let's go ahead and test some muscle strength. So, I'm laughing. And pressure face against my hand, face against hand. And for trapezius, we're going to say the strength, 5 out of 5 to resistance, bilaterally. Shrug your shoulders. And again, shoulder shrugs, 5 out of 5 to resistance, bilaterally. And we didn't do clenched jaw, so clench your jaw. I'm feeling the masseter muscle. And then I'm going to say, don't let me open your jaw. And she needs to be able to have strength to keep her jaw closed. Okay, now we'll examine her lymphatics. So first I'm going to feel your nose. We have your creator pillar, and your posterior pillar, and your occipital, and your tonsillar, and your submandibular, and your submental, and your cervical chains, both sides of the sternocleidomastoid. And you come forward for me. We have supraclavicular and infraclavicular nodes that we're feeling for. And we need to do axillary nodes. You could do them now or you could do them later. I'm just going to go ahead and do them now. We need a nice soft arm. Be the best way. And sorry about this. We're going to go deep central. And with deep central, it's a lot more pressure than you think. Posterior, anterior, and lateral. We'll do those bilaterally. Okay?
For the exam, you'll do both of them.
Yes, definitely do both of them. We have inguinal nodes left. We'll wait and do those with the abdominal exam. They seem to go better there. Okay, so now that brings me to my respiratory assessment. And can I have you turn around? Typically, your patient's not going to be doing all the work. We will be, but you are videoing all kinds of things. Then we do a respiratory assessment. First, I'm looking at her work of breathing. Is she using any accessory muscles? Does she have any retractions? I can do capillary refill again. I can look for nasal flaring. Looking at the general shape of the chest. I'm looking at her anterior, posterior diameter. I'm going to check for lumps, bumps, or lesions. Her skin is uncovered right now. Do you have any tenderness when I palpate you? Okay, I'm going to check for chest expansion. So can you take a deep breath? I'm going to have my hands together with a piece of skin pushed up in between them, and when she takes a deep breath, we have even inhalation and exhalation. The next part of your exam is percussion. So we need to make sure we're percussing above the scapulae posteriorly. So you'll percuss in 3 spots on both sides. And then we're going to come down approximately every other intercostal space, not percussing on the scapula. That was on a rib. Did you hear what that was? Get down to the bottom of her lungs. We need to make sure we do some extra percussion. 2 spaces on each side. When you're doing your percussion, it should be side to side, bilaterally. We need to, if you want to show this elbow in front of you, that would be great. I'm going to percuss her lateral lungs, 4 spots. You do it on the other side, and 4 spots. Okay, now I'm going to listen to your lungs. I need you to take a deep breath in and out through your mouth. If you start to feel dizzy in any way, let me know and slow down. So you need to put your stethoscope where you would expect to hear good lung sounds in and out. And you should listen for the entire breath. Break from deep breaths. And now I'm going to listen to your lateral lobes. So the same spots that I percussed. Deep breaths. Okay. Again on the side. Deep breaths. The last thing we need to do for posterior chest assessment is CVA tenderness, and that's looking for tenderness in the kidney area. So CVA is costovertebral angle, the end of the ribs. Costo is ribs. Vertebral angle is the straight across. So I'm going to tap any tenderness. You can do an indirect tap like that.